the most effective and least expensive mouthwash. The science behind this was presented to me at a meeting in Mexico City in the early 1990s by Dr. Jorgen Slotz, who at the time was the Associate Dean for Research at the University of Southern California. He's not only a periodontist, but also has a PhD in bacteriology. And this is the reference that you may want to look up. He advocated using a 0.05 solution of sodium hypochlorite as an oral rinse. He used 1 teaspoon per liter or quart and used plain and unscented sodium hypochlorite, which is household bleach. You'll notice that I'm showing you here some measuring devices, and always use a measuring spoon to accurately determine the amount of sodium hypochlorite used to make the oral rinse. There's a great tendency to just dump a little in and arbitrarily think you're getting the right amount. Please, please do not do that. For instance, we look here and on the top we see a teaspoon and the bottom a tablespoon, and we do not want to use a tablespoon, for more is not better. Let me say that again. More is not better, and very accurately measure the amount in so that you do not get too strong a solution. So here are the two things you need: a quart jar or a liter bottle and the measuring device. Before using the solution, please watch the importance of cleaning your tongue, which is on this video. How do you use the solution? First, use only an ounce or so to do this, about a jigger, if you will, and swish this between your teeth. Gargle to kill the bacteria and oral pathogens that remain after brushing and flossing. And also in gargling, this kills those pathogens associated with postnasal drip. Before rinsing, use the tongue sweeper to scrape the slime off the posterior portion of the tongue. Rinse vigorously with plain water and spit it out. Does the solution degrade and lose potency over time? What is the answer? Yes. So the solution is to discard and make a new solution approximately every 2 weeks. What if excessive probing depths result after periodontal therapy? Is it effective in these, but it's used a little differently? First of all, the solution can be used in a water irrigator to force the solution deeper subgingially. In this case, a solution of 4 teaspoons to a gallon of water, that's 4 quarts, may prove more practical by avoiding frequent mixing of the solution. A disclaimer. This information is being provided to you for information only, and the solution should only be used at your own risk. This is not a prescription, and remember, the solution should only be used at your own risk. The solution is highly effective, and it kills bacteria, viruses, spores, fungi on contact. Under no circumstances should it be swallowed. Children should not use the solution because they may inadvertently swallow some of the solution. Pregnant women or women anticipating becoming pregnant should not use this, as the impact on a developing fetus is not known. Let's talk about the side effects of ingesting sodium hypochlorite. Drinking bleach can cause effects that range from mild to serious, depending on the amount ingested. Medline Plus states that consuming dilute bleach or sodium hypochlorite may lead to mild stomach irritation. Ingesting larger amounts can lead to gagging, to pain in the mouth and throat, burns in the esophagus, chest pains, low blood pressure, slow heart rate, delirium, coma, shock, vomiting, and stomach or abdominal pain, and perhaps even death. But what I'd like to point out to you, we are not using a strong solution, and probably the only thing that would result from this, if you swallowed it, would be some minor stomach irritation. Historical thoughts and future direction. As a 12-year-old in the early 1950s, the Virginia Health Department came to our school and applied topical fluoride. The question now is, does using this oral rinse have the same potential impact on periodontal disease that fluoride had on the reduction of dental caries? Just something for you to think about.